Good evening, people. Can you hear me? Good evening, all of you. Can you hear me? Hello, can you see me? Can you hear me? Yeah, now is it fine? Is it better now, people? Okay, thank you, people. Thank you for coming on time. Thank you very much. Now, let's go to the session. Before we go to the session, for all the people who are newcomers, let me tell you, I'm Dr. Meenakshi Sundaram, and I am actually teaching microbiology and biochemistry on the educator platform for Unacademy. And this is the crack NEET PG idea from the India's largest learning platform called as Unacademy. And this is mandatory for me to tell you, so just be patient when I tell you this. You have daily live classes, you have structured courses, you have live tests and quizzes, and you have unlimited accesses if you can subscribe for Unacademy. And when you're subscribing for Unacademy, if you want to have very special packages about my classes, then you can subscribe to Unacademy using this code Dr. ASM-YT. And right now the revision batch course for FMG 2020 is going on. I'm a part of it. Concise batch course for NEET PG 2021 is also going on. I'm a part of it, and I'm teaching microbiology and biochemistry. Now let's look at the subscriptions that you can have. You can go for 1 month, 3 months, 6 months, 12 months. The best is always going for 24 months or 12 months. But if you want to check out how Unacademy fares, you can actually go for the 1 month subscription. So good evening, all of you. Gautam Devan, the session is for half an hour. Is that fine for you? Okay, now I'm going for the quiz contest as such. Yes, now before we go to the session, I would want you to go to the website called as menti.com and use the code 803645. Please go to the website on your browser. I will type it here. Please visit menti.com and use code 803645 to play the quiz. We have 34 people till now joining us. Others, please join faster so that we can start it now. And I'll give another 30 seconds for 1 minute for everybody to join us. Let me tell you something. Be the Doc is a quiz contest where this is a round where I'll be giving you a case discussion. Unlike in the previous quizzes, when the question comes and then the countdown is over, people have to go for the buttons and buzzers faster. They have to give us answers. But this is unlike that. You will be having a picture in which I would have written all the kind of statements that you are needing it. So you will be given enough amount of time to read the case. After reading the case, the question will be just one line. Previously, the questions could have been lengthy for you. You would have missed a lot of the questions because you were trying to answer them. But now you will not miss anything. I will give you adequate amount of time to read the case history. And once the case history is done, you will be having a question based on the case scenario. I may ask you for the diagnosis, or the diagnosis would be very obvious for everyone. I'll be asking you something else in the form of investigation or management. And if you have any questions, you can ask me now. I am waiting for the other people to join as such. As we play, more people will be joining us, I hope. But look at this. Website once again, www.menti.com, and use the code 803645. Take every question as a serious question. Treat as if your life will depend on this question. I'm not saying this question is very important because I'm putting it forward. Take every question as a challenging question for your life. See if you come across such a situation in your real life, how would you handle it? And if it's a life or death situation, if it's a life-threatening situation, how would you handle it? And that is where quiz contest will make a huge difference in the outset of your perspective towards life. Oh, what is the code? Manisha, can you see the code on the top? I have just now typed it right. Manisha, can you see? The comment before your comment is my comment. I have commented about the code 803645 to play the code. Play the quiz. Did you get it, Manisha? Yes. So if you get one more person with 70, we can start it. Yes, the time has started. Let's go for the first question. Look at the case history. I'll give you enough amount of time to read the case history. Yes. Thank you, Rahul Soni. A 4-year-old boy had a fall and broke his arm. History reveals several episodes of uncharacteristic easy fractures in his legs from minor falls. No family history of bone pathology. On examination, bowing and deformities of the legs are noticed. X-rays are showing you evidence of previous fractures and osteopenia. You suspect a collagen vascular disorder and you order a skin biopsy. Biopsy reveals unstable type 1 collagen due to a single point mutation in one of the type 1 genes. I repeat, you have made out that this can be a case of collagen defect. So the doctor, as you have gone for a skin biopsy and you have found out that there is an unstable type 1 collagen going the rounds and due to a single point mutation in one of the type 1 genes. This is the question. Excellent people. I hope you have read the question already. Do not go for the answer first. First, yes. Now this is the case history. I have given you enough time to read the case history. Let's go for the question now. I'm starting the quiz right away. Right now we have 90 players going the rounds. Excellent people. Excellent. Now I'm going to start the question. You know the case history now. Now look at the question. Answer fast to get more points. Which of the following substitutions might be the reason for the given clinical picture? What substitution might be the reason for the given clinical picture? Is it glycine becoming leucine, or tryptophan becoming tyrosine, or proline hydroxyproline becoming hydroxyproline, or alanine becoming aspartate? Which one is it? Among the four, which one would be the right kind of substitution that has given rise to such a clinical picture? I hope you had enough amount of time to read the question. Now you should be in a position to answer quickly. So we have four options in front of us. This is a collagen vascular disorder. It might be glycine becoming leucine, it can be tryptophan becoming tyrosine, or it is proline becoming hydroxyproline, or alanine becoming aspartate. We have 25 more seconds. We have received 80 answers. Come on people, you can do it. Yes, come on people, 15 more seconds. Okay. We have 5 more seconds. Here, I'll just tell you the answer. I'll explain you at the end of the session if you're still interested. I'll explain you the answer if you're still interested. Excellent. This was a clear-cut pitfall that I had dug for you. I dug a pitfall for you so that you will fall exactly into the pit. That is what was the intention of this quiz question. Please understand, every time a quiz master is falling you into a pitfall, you should actually be taking it very seriously. You should bounce back and punch the quiz master on the face. At least not literally. You should be in a position to make him realize that you are better than what the quizmaster can guess you for. The right answer is glycine becoming leucine. Out of 29 people out of 95, that is 29 people are given the right answer out of 95, and I'm not very sure if all 29 people knew exactly why the reason was that. Let me tell you the reason at the end, but if at all you knew the real answer and you know the why the answer is A, then I'm really happy for you. You are the kind of person who will be knocking all the charts on the top of the AIMS exams and PG Chandigarh and JIPMER exams. So 51 out of 95 had given the answer as proline hydroxyproline, because you understand that proline hydroxyproline conversion is important for the whole concept called as collagen. But please understand, the question was about collagen defect. If proline is becoming hydroxyproline, it is good for the collagen. It is not bad for the collagen. So that itself will fail you on the option called as C. Okay, we'll see who's on the leaderboard. Okay. Now, newcomers have actually ruling the roster. Vaishnavi is on top. Vaishnavi has given the fastest. Swati has given the second fastest. And Room, Millie, MK, Niru, ABCD, Thomas, Zlatan, and Partwan, all of you have been on the top. Other people, yes, please come for it. You should be in a position to answer the next question. Now we are going for the case. Take your time. Look at the case carefully. A 2-year-old boy had persistent anemia and exhibits features of failure to thrive. The child is showing failure to thrive features. Lab investigations are revealing microcytic anemia, point number 1. The blood lead levels are 3 times higher than the normal levels and high levels of coproporphyrinogen 3 in the urine is seen. The child was put on chelation therapy and recovered uneventfully. The cause of the child's difficulty was most likely due to the defects or the effect of the lead. So, I do not want you to give me an answer as lead poisoning. I am telling you it is lead poisoning and I am giving you the clinical features as microcytic anemia, blood levels being 3 times more than low normal and high levels of coproporphyrinogen 3 in the urine. Now, if this is the case history, if you have gone through the case history properly, let me go to the question. Answer fast to get more points. In this condition, which of the following enzymes is involved in the poisoning with respect to the given clinical picture? A. Delta-aminolevulinic acid, B. ALA dehydratase, C. Ferrochelatase, and D. Coproporphyrin 3 synthase. Among the 4 enzymes, which one is the most involved in the given clinical picture? Think twice before you actually choose an answer. These questions will be very simple, but I'll make it very tricky in such a way that you can actually fall into the pitfall. So every time you fall into a pitfall, you are coming out with a stronger result to tell yourselves that you are not going to fall into such a pitfall in the next question. That is where you improve. That is where I improve. And when you stop falling into the pitfall, it means I am becoming more and more boring, and because of which I'll up the ante of my questions so we both can learn from each other. We both can learn from each other. Okay, now we have 16 more seconds. I have received 100 answers. Excellent going, people. Come on. I have 10 more seconds. Is it delta ALA synthase? Is it ALA dehydratase? Is it ferrochelatase or coproporphyrin 3 synthase? Okay, the time is up. We'll see who has actually got the right answer. Okay. In case of ferrochelatase being the right answer, 34 out of 104 have given the right answer. It means the remaining 70 people have made it wrong. And the most common answer they have given is ALA synthase or ALA dehydratase. It is understandable that you have learnt about lead poisoning, you have learnt about porphyria, you have learnt about heme synthesis also and the disorders of heme synthesis, and you also know how lead can play an important role in interfering with heme synthesis. But you have taken into consideration every single aspect of the question so that you will be able to narrow in on one single enzyme rather than the other enzymes. Okay, we'll see who's on the leaderboard. Okay. Now Swati has displaced and she has been on the top position. Excellent, Swati. Suri Nandana has come back like a fire. Saranan is on 3rd, Frank 4th, HHH is 5th, Treta H is 5th, ABCD is 6th, Gayatri is 7th, Kartika is 8th, Earthman is 9th and Vishwa is 10th. Excellent going, people. Now let's go for the next case discussion. This is the case. I'm going to give you enough time to read the case. Look at this. The lady is middle-aged. She's suffering from hypertension and there is hyponatremia, hypokalemia and alkalosis. Plasma glucocorticoid levels are well within the normal limits. Mark my words, you have alkalosis, you have hyponatremia, you have hypokalemia. Glucocorticoid levels are well within the normal limits. Renin and angiotensin 2 levels are less than normal values. Ultrasonogram reveals an adrenal cortical mass. So we are done with the case discussion. That is, the case has been given to you. The history and the points for examination has been given to you. Hypertension, hyponatremia, hypokalemia, alkalosis. 4 important features. At the same time, you have to focus on renin and angiotensin 2 becoming lesser than normal. Ultrasonogram reveals adrenocortical mass. Let's go for the question, people. Answer faster to get more points. If this is the case, these symptoms are likely due to the excess production of which of the following hormones? Which hormone will be elevated? A. Cortisol, B. Estriol, C. Estradiol and D. Aldosterone. We'll see who's on top at this point of time. Come on, people. Yes, we still have 40 seconds, but we've received 80 answers. Come on, people, you're doing a great job. Remember, at the cost of being faster, please do not miss out on accuracy. Accuracy is even more important. So in this given condition, which hormone will be elevated? Is it cortisol, estriol, estradiol or aldosterone? Okay, we have 20 more seconds. I have received 99 answers. Okay, 100 answers. Anonymous doctor, please don't give us answers in the comment box section. Please go to menti.com at the top of the screen that you can see. Use menti.com on your browser and use the code 803645 to play the game. Even though your answer can be correct. Roshni, please understand. I think Roshni, you have played this game before. Please don't give us answers in the comment box section. This is a quiz which has a structured pattern, and you have to go to the website called as menti.com and use the code 803645 to answer parallelly. Please answer parallelly along with that. Okay, so this is supposed to be an easy question. We have received 83 right answers. That means you are all stronger right now. Now you have made a huge difference, people. Come on, excellent going. We'll see who is on the leaderboard right now. Okay, Swati is on. Okay, Surinandana has displayed Swati, and Arun RPSG, ABCD, Triple H, Tetra H, Kartika, Vishwa, Rakeshi, Snehalakshmi and Vaishnavi have been on the top 10 position at the end of 3 questions. Snehalakshmi has jumped into the top 10, and she's given the fastest answer for this question. Okay, let's go for the next case discussion. A young boy presents with persistent leukocytosis. History reveals that the boy has suffered from recurrent infections. I repeat, the boy is presenting with persistent leukocytosis. The elevation of WBCs is not transient, it is persistent. And the history reveals that the boy has suffered from recurrent infections. On examination, severe growth and mental retardation is seen. The child harbors a very rare blood group called as Bombay blood type at the ABO locus, which is referred to as HH blood type. So the point to be considered is persistent leukocytosis, recurrent infection, growth retardation, and the rare Bombay blood type called as H blood type. Let's go for the question, people. These findings are consistent with the child suffering from the following. Which are the following disorder? Name the diagnosis. In this question, he just won the diagnosis. Is it eye cell disease? Is it leukocyte adhesion defect 2? Is it pseudo-Hurler polydystrophy? Is it congenital disorder of glycosylation type 2? Among the 4, which one is the right answer? Focus on leukocytosis, focus on recurrent infections, focus on growth retardation, and having a very special blood type called as Bombay blood type. All these 4 are classical tetrad for making a diagnosis of this condition. I think you should be able to give me the answer. And on Unacademy platform, on a capsule course of immunology, I have taught about leukocyte adhesion defect as a part of this condition. I have actually discussed about pseudo-Hurler polydystrophy. I have discussed about congenital disorder of glycosylation. And in case of biochemistry special session, I have discussed about eye cell disease. All these have been discussed in the past in the special group. So subscribe to Unacademy if you will. And you can actually enjoy the benefits of almost 40 major heavyweight champions of teachers who are teaching you. So make the best use of it. 4 conditions, out of which one is the right answer? Okay, the time is up. I have received 108 answers till now. Let's see who's on top. Okay, 48 people have given the right answer out of 108. It means 60 people have made mistakes, but the number of people who got it right has jumped out heavenly. So I'm really happy with it. The right answer is leukocyte adhesion defect 2. Okay, leukocyte adhesion defect is a problem in case of defective leukocyte based clearance of the microbe, because of which you have recurrent infections. Okay, we'll see who's on top now. Surya Nandana is still on top. ABCD has given the fastest answer for this question. Vishwa is third. Vaishnavi, Saucy Bannu, Saranan, Swati, Deepu, Dhruv, Parth 1. Okay, excellent, Saucy Bannu. I'm happy to see you again. Saranan, you have actually come into the top 10. Swati, you have dropped down. Come on, do not actually go downstairs. Deepu, Dhruv and Parth, you have made your presence felt. Excellent going, people. Let's go for the next question. A 50-year-old gentleman is admitted to the hospital with fever followed by severe diarrhea for the last 24 hours. The gentleman is having fever, severe diarrhea, and it is acute. It has been only for the last 24 hours. Cultures have been sent. What are the samples that have been sent for culture? Blood, CSF, urine, stool. All the cultures came back negative for microbial infections. Then you went for biochemical investigation and you tested for the gut hormones. And the gut hormones reveal elevated levels of vasoactive intestinal polypeptide, also referred to as VIP. This is the case history. There is severe diarrhea and fever, no microbial infection, but biochemical investigation is revealing increased levels of vasoactive intestinal polypeptide, which is VIP. Let's go for the question, people. An analog of which of the following given options would most likely lower the VIP levels? The patient is having high VIP levels. Among the following 4 compounds, who can decrease the VIP levels? Vasoactive intestinal polypeptide. We have 50 more seconds. I have already received 35 answers. Come on, people, you can do it. Excellent people. Yes, we have 30 more seconds. I have received 88 answers. Come on, people. Among the given 4 options, who can decrease the VIP levels present in the patient? Blood VIP levels can be brought down by which compound? Yes. Come on. We have 15 more seconds. Manika Agarwal, please don't give us answers on the comment box section. I understand you are new to this place. I haven't seen your name before. But if you're really willing to play this game, go to menti.com and use the code AT3645. You can see that on the top of the screen. Go to menti.com and use the code 803645. Excellent people. You will be amazing. You are improving by leaps and bounds. I'm really happy with you. This was supposed to be a moderately easy question and moderately tougher question, but I have received 65 out of 108 answers to be correct. Good going, people. And please remember one thing. I just want to take a special moment to tell you this. You all have played a wonderful game. All those people who have been consistently playing this game, you would have scored some amount of marks. All these marks are noted by us and we have an Excel sheet maintained. This app will be able to transfer all your marks to us at the end of all the sessions. That is, the Thursday session is the last session for this month. At the end of Thursday session, we will take into account all the 6 sessions that you have attended, and whoever comes on top 10, you will be able to get into the area where you can get many amount of prizes. Yes, star, please don't give us answers here. If you're really willing to play the game, please go to menti.com and use the code 803645. Please tell us 803645 is the code. Go to menti.com and use this code. 65 out of 108 people have got it right. And please remember, you all are amazing students and you're here because you are having the love for the field of medicine. And whoever is actually taking the time out at 9 o'clock on a particular weekday, you are coming here to play this game, right? I am really grateful to you. I bow my head to you. And think about it. The world tries to push us down. The world always tries to suppress us. Here, even when I'm trying to run the quiz here, even before I started the quiz, there were 2 people who had put thumbs down for no reason. But if at all they had come to the quiz and then they put a thumbs down, it is understandable they don't like this query quiz. But the quiz is a venture to help you reach more amount of knowledge. So that tells you, if these people put thumbs down and I actually get suppressed, it means the negative things are getting suppressed. The negative things are capable of suppressing the good things in the world. We will not be able to come out bouncing back. Every time I make you fall into a pitfall, that is an indication to tell you that the next time you have to rise very strongly. Remember, we all are made up of steel. You can decide whether you are mirror, glass or steel. Whenever you actually give a lot of heat, the hammer can always crush glass, but it can always forge steel. So you ask yourself what you are. Let's go for the next question. Next case discussion. Thank you, Shreyas Virwani. Okay, now ABCD has lost this answer, I guess. So ABCD loses the second position. But Suryanandana has given the fastest answer for this question also. Come on, Suryanandana. Vishwa is on second, Vaishnavi is on third, Saucy Banu is on fourth, ABCD is fifth, Azhar is sixth, Saravanan is seventh, Swaminathan is eighth, Triple H or Tetra H is ninth, Path 1 is 10th. So Dhruv has been pushed out, but I know Dhruv will bounce back. Vaishnavi has come on top. Vishwa, amazing, you're sticking on to the top position. And Suryanandana is a very cool candidate. I remember him playing all the previous quizzes. He never gives up his spot. So this is a challenge for you people. Come on, fight your breath out. At the end of it, I know that you will come out as a victor. Next question, take your time. Middle-aged man of Mediterranean descent has a 3-day history of fatigue and shortness of breath. He was prescribed cotrimoxazole for a recent mild UTI. The heart rate is 120 per minute. On examination, pallor and scleral icterus was noticed. Lab investigations are revealing a fall in the RBC count and a rise in the serum indirect bilirubin. I repeat, the middle-aged man is from Mediterranean descent, that is the Central Africa and the Central Arabian area. 3 days history of fatigue and shortness of breath. He has fatigue, shortness of breath. Shortness of breath should indicate something in you. He was prescribed cotrimoxazole for a mild UTI. On examination, pallor and scleral icterus was noticed. Lab investigations are showing fall in RBC count that can count for the shortness of breath. There is a rise in serum indirect bilirubin. So automatically you would have made up your mind right now. You don't have to give me the diagnosis, but look at the question. We are going for the question from this case history. Answer fast to get more points, people. What is basically the failure in the given situation? What is the failure in the given situation? Is it the bone marrow production of reticulocytes failing? Is it the erythrocyte production of lactate that is failing? Is it erythrocyte defense from the membrane oxidation that is failing? Is it reticulocyte synthesis of heme that is failing? Which one is failing? Among the 4 functions, which one is failing that is giving rise to the given situation? Yes, 43 seconds remaining, 49 answers have come up. Excellent, people. I'm really happy you are making it a point. You are going full head ahead. You're going full throttle. I'm really proud of you people. If you keep continuing going at this particular pace with this amount of aura and this amount of Josh, I'm really sure that no tough question will be scary enough for you. You will always find any tough question to be easy for you. The more you keep on training yourself, I'm pretty sure you're capable of winning big battles. Remember, the more you sweat in the practice field, the less you will bleed in the battlefield. Take every single tough question in the quiz contest as a way to train yourself. You are going for bigger. You are meant for bigger leagues. Okay, the right answer, we'll see. I believe that most of you can give me the right answer for this. In the given situation, yes, 76 out of 112 have got the right answers. Erythrocytes defending from the membrane oxidation has been a failure. It can be a G6PD deficiency, because of which you are not able to keep the membrane in the reduced state, because of which you might be suffering from hemolysis. This is a classical case of hemolytic jaundice. I believe that you know it already. Excellent. Now let's go for the leaderboard. Yes, as I told you, Suryanandana is a customer who never gives up his position. Suryanandana is on top, Vishwa is on second, Saucy Bannu has moved even up, and Swati is on fourth, Sarana is on fifth, Parth is on sixth, Swaminathan is on seventh, Azhar is on eighth, KG is on ninth, and Gautam Devan is on 10th. Gautam Devan, yes, you have come into the top 10 league. KG, I am seeing you for the first time and I'm really happy. Others who have actually left the top 10 position, you have to fight tooth and nail to come back to the top position. And those who are at the top position, you have to keep on holding on to your positions. Please understand, this is just a replication of what your life is. This is a reflection of how your life would be in the world of competition. Excellent going, people. Come on, let's go forward to the next case history. The case history is simple. 5-year-old child, progressive muscle weakness. You have muscle biopsy, tissue from this patient was done. Muscle biopsy, tissue from the patient was done. Mitochondrial oxidation of succinate is normal. You went for all the analysis in the muscle, and under basis of the biochemical analysis, mitochondrial oxidation of succinate is normal, but pyruvate oxidation is abnormal. And please remember, pyruvate dehydrogenase complex is actually normal. Malate dehydrogenase complex is normal. Mitochondrial extracts are showing that there is no problem with the PDH complex. There is no problem with the malate dehydrogenase. There is no problem with succinate oxidation. If there is no problem in any of these, then what is the problem and where is the problem? I repeat, 5-year-old child, muscle weakness, muscle biopsy was done, mitochondrial oxidation of succinate is no problem, pyruvate dehydrogenase complex no problem, malate dehydrogenase no problem. Let's go for the next question based on this particular case study. Answer fast to get more points. The results are consistent with the patient harboring a defect in which are the following mitochondrial components. So, is it the problem in the ATP synthase complex? Is it the problem with complex 1? Is it complex 2 or complex 3? We have 50 more seconds. Come on, people. I'm really glad that you're answering slowly at this point of time. You're doing it because you're giving it a thought. You are trying to understand what exactly is happening. Succinate is normal, PDH complex is normal, malate dehydrogenase is normal, but progressive muscle biopsy is showing that your mitochondrial oxidation with the excess amount of pyruvate can be seen. Progressive muscle weakness is seen. I can give you a clue. You can have. Okay, no problem. Let me not give you the clue because many people have already answered. It will be unfair for those people. We have 16 seconds more. We have received 1 or 3 answers. 16 seconds. Yes, 10 seconds. We have received 1 or 7 answers. Come on, people. Come on. Okay, now we have 112 answers. 113 answers right away. Excellent going, people. You have done a great job. Okay. The most common answer given is ATP synthase, but it is wrong. Complex 1 is the right answer. Okay, complex 2, complex 3 both are wrong. Please remember one thing, people. I said succinate dehydrogenase is not a problem at all. If succinate dehydrogenase is not a problem, then complex 2 cannot be the problem. At the same time, complex 3 is not unique for causing muscle weaknesses. When I say muscle weakness, always take into account that pyruvate accumulation can turn into lactate. Pyruvate can accumulate, it can turn into lactate. I repeat once again, when they speak about muscle weakness, unless and otherwise specified, you will take pyruvate accumulation and lactic acid accumulation. When I said PDH complex is not a problem, still why pyruvate might be accumulating? Because the complex 1 is not working. It means the NADH is not able to give the electrons to complex 1, because of which NADH accumulates. When NADH accumulates, pyruvate to lactate is actually increasing, because of which lactic acidosis might be possible, because of which you'll have muscular weakness. Okay, you have played a wonderful game. Let's see the leaderboard right away. Okay, now many people would lose their positions, but not Surinandana. Surinandana has come out on top. Excellent Surinandana, congratulations. Second is Saravana, third is Vishwa, fourth is KG, amazing game. Saucy Bannu, fifth, Pranav Ganesh 6, Surendra 7, Deepu 8, Neeru 9, and Swati 10. Excellent going, all these people. Now we come to the end of the session. Now we have 121 people on the online right now. Now let me give you the explanation for the previous questions in ultra short mode. Let me give you the answers for all the questions. In the first question, we were looking for what was the change. We wanted to see who changed. The answer was glycine becoming leucine. Please look at the structure of this whole collagen here. You have glycine at the junction and you will be having the compounds as glycine, proline and X. So you can have X at the same time. Glycine should be 1/3 of the load of collagen. What is the function of glycine? The hydrogen bonds linking the peptide bond of nitrogen of a glycine residue with a peptidyl carbonyl group in the adjacent polypeptide help hold the 3 chains together. I repeat once again, you require the hydrogen peptide bond, hydrogen bonds linking the peptide bond of nitrogen of a glycine to hold the bonds. So if at all you can change alanine to aspartate, doesn't matter. Thank you, Shreyas. Thank you very much. If you could listen to the explanation, I'll be very happy. Look at this. Glycine is a must. You can change alanine to aspartate. You can change tyrosine to tryptophan. It will not affect the most important harboring areas like this and this. Glycine is important for giving you the kink. So to give the kink, if I replace glycine coding amino acid with that is glycine coding codon with something else, then that would make you lose the ability of glycine to hold on to the collagen properly. So because of this role of glycine in collagen, it is indispensable for normal collagen structure. So when glycine is replaced by leucine, leucine will not be able to offer the hydrogen bonds for linking the peptide. That is why glycine replaced by leucine is the worst affected area for the collagen defect. Also remember, if at all proline has been replaced by hydroxyproline, it doesn't matter because anyway proline is going to become hydroxylated for the collagen's vascularization and proper maturation. So that will not have a major effect. That is what most of the people made a mistake of. Okay, look at the picture here. This is glycine plus proline plus leucine plus hydroxyplurin. If I bring leucine here, you have 2 hydrogen, but this is a non-exchangeable hydrogen. In this area, you'll be having an exchangeable hydrogen if it was glycine. If it was glycine, this area would have been an exchangeable hydrogen, because of which you are suffering in this particular manner. Okay, now in case of the porphyria question, remember lead can block ferrochelatase, ALA dehydratase and ALA synthase. How did I choose ferrochelatase as the answer? Among the 3 given enzymes, the maximum attraction for lead is for ferrochelatase. So ferrochelatase enzyme is the most sensitive for the lead poisoning. Next one is look at the levels of the coproporphyrinogen. Coproporphyrinogen comes very deep down the heme synthesis area. When you start with glycine and succinyl-CoA, when you come to the bottom when it forms heme, this is the area where just before the heme formation, coproporphyrin can be seen. Now that is the area where ferrochelatase can play a role. What is ferrochelatase? It is chelating the ion called as ferrous so that it can form heme. So heme formation's previous step is ferrochelatase, and that would mean to say that if coproporphyrinogen is not actually forming to become protoporphyrin, then coproporphyrinogen will be increasing. Now please remember, ALA dehydratase and ALA synthase are very high up in the order, because of which you will not be able to get the right answer. So in the question, the most important keyword is coproporphyrinogen accumulation. Rahul Soni, I thought you will be listening to the session. It's okay if you want to leave. I'm sorry that you're leaving, but the next session is on 28th Thursday. The time is 9 p.m. once again, and that will be the last session in this month. Those who are actually coming to that session will be collecting all the data, will be seeing who comes on top. Okay, and the next question was about, thank you Parth Lakpatia. Now the next is, for the next question, I spoke about persistent leukocytosis, right? That case is LAD2, leukocyte adhesion defect, and in this you will be having one important problem. When the leukocytes are not behaving the way they are behaving, then it would be called as a primary immune deficiency syndrome. It's a class of disorder called as primary immune deficiency syndrome. In this problem, you will be facing recurrent infections. So remember, defective neutrophil chemotaxis, severe growth and mental retardation, and persistent leukocytosis are all classical features of LAD. Why persistent leukocytosis? The already existing leukocytosis are not functioning, so your body will take a futile step to keep on producing more and more leukocytes to fight the problems. And remember, the defect, genetic defect, is that LAD2 is in the pathway of fucose utilization, leading to loss of fucose-related glycans on the cell surface. If this is a leukocyte, and you should be having some antigens who should be getting fucose. If that fucose is not bound to the antigen, the non-fucose-related antigens are present on the surface of these kind of WBCs. So the WBCs will not be able to perform normally like phagocytosis or clearance of an organism. So I repeat once again, lack of fucosylation of the antigens present on the surface of leukocytes, which will make the leukocyte adherence defect more probable. Now this is the theory part. You can look at the theory part when you have time by pausing the slide on YouTube. Let's go for the next question. In the given question where we had severe diarrhea and fever, it was because of any kind of mass that was producing more amount of vasoactive intestinal polypeptide. There is no compound called as antimotulin. Please remember, it was just a fun sake addition. I added it out of cruel thought process. I'm really sorry about it. There is no compound called as antimotulin, but somatostatin is the best choice. What does it do? Because it has a broad range of inhibitory effects, it can inhibit the GI secretions. At the same time, it can decrease the GI motility. Why is this too important? For any kind of diarrhea to happen, increased peristalsis will take a major role. Then increased secretion will take a major role. Somatostatin has an effect of inhibiting GI, and also it will slow the GI motility. It reduces splanchnic blood flow, because of which the formation of stools can be brought down directly. Diarrhea can be resolving. And in another case where we saw about a female who has an adrenocortical mass, you will be having aldosterone excess. Remember, synthesis of aldosterone is primarily controlled by renin-angiotensin system. Because of excess aldosterone, there was a feedback inhibition of renin and angiotensin 2, because of which these were lesser. At the same time, aldosterone can cause sodium reabsorption by the kidney, because of which you have hypernatremia, and excess loss of potassium, because of which you have hypokalemia, and because of excess amount of water collection and blood in it, you will be having hypertension. So all these things will tell you that there is an increased fluid volume. You can also have puffy faces in the patient. So you are actually a very good source of knowledge for all the people here. And the next question, some people might have actually found the question slightly difficult. Remember, muscle weakness means you are expecting myopathy. At the same time, you can look for lactic acidosis. You can look for pyruvate accumulation also. So in all these conditions, you expect pyruvate not becoming lactate. That is because the NADH who is present here is not becoming NAD. Why? Because the complex 1 is not accepting the electrons. When complex 1 is not functioning properly, NADH remains the same. So think about it. You have pyruvate. You have lactate. Pyruvate is a keto acid. Lactate is a hydroxy acid. When lactate is trying to become pyruvate, it is supposed to lose the hydrogen so that NADH can be formed. And that NADH is not moving forward. Lactic acid starts accumulating because it is not capable of becoming pyruvate. So remember, in this condition, there is no problem with PDH complex. There is no problem with succinate complex. There is no problem with complex 2, 3 or 4 or 5. The only problem is complex 1. Thank you very much, Rahul Soni. So I have given you enough amount of discussion and justification for all the answers in the quiz session, and this quiz is meant to improve your skills, improve your speed with which you can attack the questions. And the third thing is to have complete authority over a logical question. You have to use logic, you have to use magic, you have to use facts, and all these things happens faster. This is the ultimate goal of having a quizathon, and if at all you keep coming for more quizathon, the quizathon will be promoted more by Unacademy. And please subscribe to Unacademy if at all you feel like the Unacademy has given you a lot of stuff to remember. And if at all you're thinking of subscribing it, please use Dr. ASM-YT referral code. You can get a 10% discount, and you'll be having unique access to my more videos in Unacademy. And for all the people who have played a very good podcast, thank you very much. For all the people who have played it with the very right spirit, I'm really grateful to you. Thank you very much. The next session is on 28th, that is Thursday. The time is 9 p.m. Until then, I'll meet you. I'm saying bye-bye. Please come prepared for the next. We'll be having major quizzes and we'll be having questions on that. Thank you very much. Bye-bye. Good night. Thank you, Kanmani. Thank you, all the people. Thank you, everyone.